Chapter 1: The Profit Divide. Is health a commodity to be bought and sold, or is it a fundamental right? This question lies at the heart of our discussion today as we delve into the profit margins of two key players in the mental health industry: pharmaceutical companies and therapy practices. Picture this: a pharmaceutical giant, raking in billions of dollars each year from the sales of antidepressants, antipsychotics, and mood stabilizers. On the other side, a humble therapy practice, charging only for the time and expertise of its practitioners. The contrast is stark, but it's a reality in the world of mental health treatment. Pharmaceutical companies operate on a global scale, their products reaching millions of people across the world. The profits they generate are astronomical. In 2023, the global market for mental health medication was estimated to be worth over $100 billion. This is an industry that thrives on the sale of chemical solutions. But what about therapy practices? Unlike pharmaceutical companies, therapy practices don't have a physical product to sell. Their commodity is the skill and knowledge of their practitioners, and the time they dedicate to each patient. This makes it much harder to generate large profits. The average therapy session costs around $100, and most therapists see around 25 patients a week. That's a gross income of around $130,000 a year, before expenses. So, why the disparity? One reason is the cost of development. It's no secret that developing a new drug is an expensive business. Pharmaceutical companies invest billions of dollars into research and development, clinical trials, and marketing. Therapy, on the other hand, requires a different kind of investment. Therapists invest in their education and training, but once qualified, the ongoing costs are relatively low. Another reason is demand. Despite the growing acceptance of therapy as a valid form of treatment, medication remains the first line of treatment for many mental health conditions. This is partly due to the convenience factor. It's much easier to pop a pill than to attend regular therapy sessions. But it's also a reflection of our society's quick-fix mentality. We want instant results, and medication often promises just that. But perhaps the most significant reason for the disparity is the influence of pharmaceutical companies. These corporations wield enormous power and have a vested interest in maintaining the status quo. They spend billions of dollars each year on marketing and lobbying, ensuring that their products remain at the forefront of mental health treatment. But at what cost? While medication undoubtedly plays a crucial role in managing many mental health conditions, it's not the only solution. Therapy can be incredibly effective, and for some people, it's a preferable alternative to medication. Yet, because it doesn't generate the same kind of profits, it's often overlooked or underfunded. Chapter 2: The Call for Change. This begs the question: are we treating mental health conditions in the best way possible, or are we simply following the money? It's a complex issue with no easy answers. But one thing is clear: we need to start prioritizing people over profits. So, take a moment today to delve deeper into this topic. Read up on the profit margins of pharmaceutical companies and therapy practices. Understand the influence these entities have on mental health treatment. Knowledge, after all, is power. And with that power, we can advocate for a mental health system that truly serves the needs of its patients. Because mental health isn't a commodity to be bought and sold. It's a fundamental right. And it's time we started treating it as such.